Hello, sweet one. I'm really happy you've come back to do your depression checkup. I have a little surprise for you and a brand new handout to help you out that you can work on over this next week. The surprise is this. I know that you like these sounds, and so we're going to just have a kind of relaxing time listening to the fire and talking while I do the checkup on you, okay? So, first off, just go ahead and let me know how you've been. This one's broken. Yeah? Well, we'll talk about that. Now, of course, as always, we're here and I'm whispering, we're talking quietly because we're in our own special, place where we can meet this special dimension, the meeting of the minds. And of course, as always, everything we do here is secret self-care for you only, not official medical advice, because you and I have never met. Of course. All right. So my first question for you is going to be part of the PHQ-9. Now, the PHQ-9 is this lovely, lovely questionnaire that we use to go back over basically the diagnostic criteria for depression, but it's with a number system instead of... Oh wow, listen to that sound. Oh man, it's with a number system instead of just going through do you have it or not. So everything that I ask you, we're going to score from 1 to 3, okay? And this is a checkup that should be part of every medical checkup you go to. You might answer the questionnaire on a piece of paper. The nurse might ask it to you on a computer. That's what I have. I have my computer up here so that I can take down your answers. And the questions, as always, are over the past 2 weeks, okay? This is not a very pretty box, but it's got the striky thing on it. So, over the past 2 weeks, how much were you bothered by having little interest in the things you normally do, little pleasure? And I don't mean like you couldn't go out and do what you wanted to do. I mean you didn't want to do anything for some reason, and you didn't know why. And your answers are going to be 0, 1, 2, or 3. 0 is not at all. 1 is several days, 2 is most of the days, and 3 is every day, all the time. And 2, it can be more than half the days, right? That's right, with the actual diagnostic criteria, every question is it more than half the days or not? Exactly. So on the PHQ-9, a 2 or above is what actually starts scoring you for the disease, for depression. But the overall number that I calculate helps me to determine basically what level of treatment you need. So there's a certain number over which I'm more likely to prescribe you a medication, and there's other numbers for which I'm going to be more likely just to make sure you get to a therapist. Exactly. Okay, so that's the first question. 0, 1, 2, or 3, my dear. Okay. How about over the last 2 weeks, how often have you been bothered by feeling down, depressed, or hopeless? 0, 1, 2, or 3? Remembering, of course, that 2 means nearly every day. Okay. I see. I'm sorry to hear that. Alright, well, let me put that down. How about trouble falling asleep, staying asleep, or getting to sleep? Or sleeping too much, that counts too. 0, 1, 2, or 3, my dear. And of course, to be honest, I'm having a little trouble right now myself. Not with sleeping, with the kind of automatic thoughts, the depression type stuff. Recently, remember I've said before, you always have the right to fire your therapist if it's not working? So, I had a lovely therapist, but she really didn't know how to manage the room with me. which meant that I would just be talking, and spiraling myself into worse depression. Because there was no one to kind of help me stop the automatic thoughts, right? Which is what we're doing with these practice exercises together. Look at that. That's so cool. I love the color blue. I think it's really lovely. And I like fire. Look at that. Is that okay? What do you think? I know, I'm a bit of a chaotic physician. I have found that my patients appreciate that instead of being rushed in and out of the room. But if you're in a hurry, you let me know and we'll make it snappy and get you out. Always willing to do that. Because that is less work, less time for me. I have other things I can do. But usually patients appreciate a little time, a little normal personability, rather than like robot machine people. Well, some people want physicians to be replaced by robots for accuracy purposes. There's a lot of diagnostic problems that are subtle and that kind of require a little bit of, there's a German word for it, but basically your gut. Yeah. There's an art to it. Because the patient sometimes isn't answering what they want to answer, or they don't have very good communication skills. So I might tell the robot something that's not going to be helpful and that's going to get them the wrong diagnosis. So the ability to kind of ask and kind of dig into what the person really means and listen to the patient's heart and what they're really suffering from, that's important, right? But I would really like to see a robot basically fulfilling the job of a resident, which would be doing research, looking into and compiling all the research protocols, so the physician can ask the robot a question, what's the most updated treatment on this, and the robot lays it out, suggests a treatment, suggests a course of action. Well, there already is a Google for doctors. It's called UpToDate, but it'd be nice to really have an algorithm that drills down, kind of like these new plant identification algorithms. You can put it in the computer and it asks you all the questions and you go in detail and it really drills down, helps you find out what to do. And it'd be neat, we have surgical robots now. It'd be neat if we can incorporate VR technology so that they're easier to train and use and cheaper. And maybe we can make the robot kind of the whole piece where it can help with surgery, it can also answer questions. I have ideas, but I'm never going to be important enough for them to matter. Alright, enough about me. It's very rude for the physician to talk about themselves the whole time. That is considered a no-no. The only time they're supposed to talk to them about themselves is when they're establishing what's called rapport, establishing a therapeutic alliance. Oh, you have something on your eye, my dear. There you go. You look lovely today, by the way. Alright, next question in the checkup. Oh, that's right, I need to write down your last one. How about feeling tired or having little energy? 0, 1, 2, or 3? Roger that. Poor appetite? Yeah. Poor appetite, like, you don't want to eat or you're eating too much. That's also poor appetite. It's not good to have too much appetite. Stress eating. So I have found that appetite is interesting, and actually I'm not sure that you will find this in most depression literature, but this is what I found with patients and with myself. After a certain point in depression, you want to eat all the time, a lot of times, depending on who you are, what your personality type is, right? You'll get stress eating. That's where you have the images of somebody who wants to sit on the couch and eat, eat ice cream. Exactly. What's your ice cream? Roger that. So, that's what you'll have. You'll have somebody who wants to kind of just sit and do eating to make themselves feel better. But the other side of that is, after a certain point in depression, you no longer care about making yourself feel better. You no longer care about eating at all. And it becomes, you just stop eating. That has happened to me before. And that is when you go to the hospital because you can't go 2 weeks without eating. I just stopped. And I didn't not eat for 2 weeks the whole week. I just ate 3 meals in 2 weeks. Because I didn't care. I no longer wanted to eat. So that is a bad sign. But it depends. Not everyone has that same order. I've seen that with other patients too, where someone, she just gave up and she no longer wanted to eat. The doctor was not very sympathetic. Kind of judgy. She was in the ICU because she wouldn't eat. I feel like, I don't know. I don't like judgy doctors. I really don't. Of course not. Well, that's why you're here. Alright, so next question after the eating. How about weight loss? Have you had any weight loss? That's just a yes or no question. I see. And then, okay. Yeah, absolutely. I know, too bad it's just normal wood. It is apparently recycled wood. I guess that's a good thing. So, I guess we're playing with trash. It's always good to play with trash. That's something children like to do, right? Let me enter in your responses. How about feeling bad about yourself? Like a failure. And maybe, and it could be true or not. Just, it's bothering you so much. Okay. And then trouble concentrating? How about moving or speaking so slowly that other people might notice? Okay. Or on the other side, being so restless and fidgety that you can't get anything done. How about thoughts that you would be better off dead or hurting yourself in some way? Okay. And that's obviously the most important one, right? Within those thoughts, the next question obviously is, do you have a plan to hurt yourself? Okay. And do you intend to enact that plan, or is it just a thought that keeps bothering you? Okay. And that's important, because there's a difference between having a plan. If you have a plan, you should always call the crisis hotline, which I always link in all my videos, or text the crisis text line. Right? You should call if you have a plan and you want to act it out. You should call. If you have a plan, don't want to act it out, you should go talk to a therapist as soon as you can. Right? You should always go to the emergency room if you find yourself wanting to act out your plan. Just set my house on fire. Not really, I didn't. That's why you see me not burning up right now. There's so much smoke. Physician dies in small closet trying to do ASMR, sets herself on fire, or dies of smoke inhalation. That would be a good headline. No, I don't have a plan. It was a joke. But thank you for looking out. We gotta look out for each other. I appreciate you so much. Alright. Now, I did want to show you, since you have family members, I do have an adolescent modified questionnaire. So the PHQ-9 is those first 9 questions. But there's also other questions that we kind of like to always ask adolescents. Okay? One of them being, have you had symptoms of depression lasting longer than 2 years? And that's a yes or no answer. Have you had similar symptoms lasting for more than 2 weeks in the past? Right? Have you seen a counselor for your depression? Have you taken medications in the past? Okay. And then, have you ever made plans to harm or kill yourself? And yeah, you can write these down. You can go right ahead. Here. Oh, you have a pen and paper. Perfect. Perfect. Yeah, write these down because they're useful. They're kind of helping you to know when to bring your adolescent in for care. And maybe they won't answer the questions for you. Maybe they have to answer them, with a therapist, right? Obviously, adolescents are old enough that they need to have a little privacy in their healthcare too, right? But hopefully they feel close enough with you that they'll answer questions with you, right? That's the idea. And if they don't, you can't force it. You just gotta do what you can do. I do a lot of adolescent medicine and military medicine. What are you looking at? You're like fidgeting. Have you been fidgeting more than usual over the past 2 weeks? 0, 1, 2, or 3? It's a hard little battle that we fight, those of us who deal with mental illness, because other people don't understand it, so they just judge you for it, and that can be very stressful, especially if you work in something like patient care, something like any kind of urgency, because people feel like they can't depend on you, not understanding that the desire to harm yourself is not the same as the desire to harm other people. They are two different things, and that's the second question your physician should always ask you every visit. Any desire to harm somebody else today? They should always check the PHQ-2. Again, just in a general checkup like this. The PHQ-2 is just the first 2 questions of the PHQ-9, which is, over the past 2 weeks, how much have you been bothered by feeling down, depressed, or hopeless? And how much have you been bothered by losing interest in the things that you normally love? And then if you're positive on those, then we go into the PHQ-9 and we see what your score is. Or like me, what I'll do is I'll go into megacaps or sigacaps, which is the way we remember the mnemonic for our full getting. Look how pretty. I don't know, it's beautiful in a weird way. Water and fire, right? Exactly. So the rest of the adolescent questions, yes. Has a family member ever committed suicide? That's a big one. And I'm pulling these up because I don't usually ask all of the adolescent ones. I usually start with just the PSQ and go from there. At any point in your life, have you gone through a period where you have the opposite, right? Where you feel very high or sped up with lots and lots of energy, right? Like you didn't need sleep, you felt like you could do anything, right? If you had those symptoms and they lasted more than a couple days or caused you to make decisions that were not ideal for your life, that's all very important. And then of course we go into some of the psychological stuff, like in the past couple of weeks. Have you seen or heard things that other people couldn't see or hear? Has anyone ever hit or touched you in a way that made you feel uncomfortable or afraid? That's important for adolescents. Obviously, obvious reasons. Have you recently experienced the death of a family member or a friend, somebody you care about? Are you having difficulty with schoolwork? Having trouble with fighting, any kind of bullying? That's a big one. I was asked that. I've worked briefly with child psychiatrists in 2 different stints. So, well, because as a primary care physician, you have to rotate in all different things, and people choose basically what they get good at. I've done extra psychiatry training just because, since I need it, it's important to understand it, I think. So, would admit patients to the hospital, would help the psychiatrist presenting diagnosis, other things like that, basically operating with or as the psychiatrist. even though I'm a generalist. And that's what you'll see a lot of times, especially with residents will do that. So a lot of generalists know how to prescribe medication, and a lot of them do not. It depends. And you should always be willing, of course, when you can't handle a situation, to pass it off to a more educated colleague. So there are medications I'm not comfortable prescribing, and I will have a psychiatrist take care of those. And I've worked with wonderful psychiatrists. And then, as a patient, I've had bad ones and good ones. There are all kinds. So, again, same thing. Never be afraid to fire your psychiatrist and get a different one. It can be challenging because sometimes they will judge you, and your colleagues will believe their colleagues over you. That happens. Never make a psychiatrist angry, because they will destroy you. Because unfortunately, there's a lot of stigma, and in our society, who are they going to believe, you or the psychiatrist? That sucks, and it's not good. So be careful, always take notes, protect yourself, right? For sensitive things, try to always have a witness, right? Always protect yourself, right? Obviously, you want to be alone and private for certain things because, you're sharing your personal things with a psychiatrist. But if anything feels off, just get out of there and get a different one. On the other hand, you have to know when you're just being paranoid, when you need to trust them. And that's tough. It's very tough when you have any kind of, so some people also have psychosis as part of mental illness. And it can be kind of tough when you have psychosis to know how to differentiate between the psychosis and real concerns, because people who have psychosis can still be targeted, right? Crimes still happen against delusional people. So it's important to have somebody in your life that you trust who can help you connect with reality in a way that is safe, right? So, ideally, you should be able to trust your medical professionals, right? That would be ideal. So we have fire, water, wood, wind. Which element is missing? I would say the sulfur is technically, on the periodic table, it's a metal. This is metal. We will be studying Eastern medicine together if you'd like to join me for a study session. So, obviously it's important to me as a Western medicine physician to practice what is evidence-based. But that doesn't mean I can't be open-minded and study other things. I'm not going to implement something with my patients unless I believe it's low risk and I can help them out with it. And if it is a high risk something that I'm going to implement, I'm going to make dang sure that the studies support it and that risk, the risk of not doing it outweighs the risk of doing it, right? Like an open heart surgery. A lot of risk. You're not just going to cut someone open for no reason. The risk of not doing it has to outweigh the risk of doing it. Yeah. Isn't it lovely? And then the next one for your adolescent. Have you ever ridden a car driven by someone, including yourself, who was drunk or under the influence of drugs? Do you ever use alcohol or drugs to feel better about yourself or to fit in? Do you ever use alcohol or drugs when you're alone? Do your family members or friends tell you should cut down on your drinking or drug use? And do you ever forget things that you did while using alcohol or drugs? Have you gotten into trouble using alcohol or drugs? Ooh. And over the last 2 weeks, how often have you been bothered by feeling nervous, anxious, or on edge, or not being able to control worry? I love this adolescent questionnaire because it includes things from what's called the CAGE, which is the alcohol screening tool. It includes things from the anxiety, depression, scorings. There's a score called the GAD for generalized anxiety disorder. There's a bunch of really good really good systems that are kind of sprinkled in here. So I like that. Yeah, we can listen to your heart and lungs. I find that this is why I'm a PCM and I don't become a psychiatrist. I've had psychiatrists ask me, wow, why don't you look into a psychiatry residency? And this is something you care about, it's something, blah, blah, blah. Because I want to be able to touch my patients. A psychiatrist should not be touching a patient. Maybe they'll listen to heart and lungs, right before they get the EKG for your, for like ADHD medications, right? But I find that depressed people need touch, they need physical exam, they need someone to be listening to their heart, listening to their belly, finding out what's wrong with them globally, not just the neurotransmitters that are awry, but how is your gut and your IBS affecting your mind, and how is your mind affecting your IBS, which we'll do an IBS visit, I promise. How is your pain affecting your depression? How is your depression affecting your pain? There's so much going on. The body is a whole system. The brain, there is a blood-brain barrier, but it is not strong enough to keep your tiny neurotransmitters and other things from passing back and forth. So everything is going into the brain and into the body. The whole system is connected. You are not just your brain. I saw a stupid meme on Facebook where they had a picture of just a brain and the spinal cord and said, "This is you." No, that is not you, because there's so much else going on. Your gut has such a huge role in what happens in your frontal cortex. Everything is connected. And so that's why I'm a generalist, because I want to be able to connect all the pieces together to take care of you. Absolutely. Let's listen to your heart and lungs. Deep breath in and out. And again, deep breath in and out. Good. Again, deep breath in and out. Good. Deep breath in and out. Good. And then here in the back. Deep breath in and out. And again, over on this side, my dear. Deep breath in. Lovely. All right, my dear. Well, that is our time. Next time we can go over medications. Based on your score, I think you should continue working with a therapist. If you are having trouble finding a therapist, or you want to supplement your physical in-person therapist, right now it's hard to see a physical in-person person. If you want to do online, I did get you a discount code, betterhelp.com/drjen. Obviously, I can't write you an insurance referral and get a kickback, because not only is that illegal, that would be unfair to you. But I am an affiliate. I can affiliate with this organization. So I am really proud to affiliate with them. They're helping support this channel, ideally. Haven't gotten any click-throughs yet. But when we do get click-throughs, it helps to support this channel and the clinic that I'm trying to build in Paraguay to help people who don't have medical care. 2023 is when I'll be there. Yep. And we need to raise $50,000 just for initial startup of the clinic, at least. We are about 3/5 of the way there, and things aren't happening as quickly as they need to. So I started this YouTube channel, and I have a Patreon, and I'm hoping that I can go help people who don't have access to care, and I can continue helping you. And so that's my goal. So the Patreon is patreon.com/becominghero, because I want to be a superhero when I grow up. And your for therapy, online therapy, is betterhelp.com/drjen. Helps you, helps me. Okay, because you get 10% off. But always important, if you can get an in-person therapist, do it. I actually sought out betterhelp.com to affiliate with them because I love the idea. I had a patient who was so anxious she couldn't leave her house and go to therapy. Her anxiety was so severe. She actually stopped coming to the doctors at all. It was one of my saddest cases because I felt like I lost that patient. If I had had an online option for her at that time, things might have been different. But I didn't. So, again, betterhelp.com/Dr. Jen, online option for therapy. Okay. I can't do official insurance referrals there, but I do like them, and I do recommend that you try them out. And always fire your therapist if you find that the first one you try there doesn't work. There's several hundred others, and that's what's so lovely about it, right? So that's what I recommend based on your score, is that you continue with your therapist, or if you can't do that, we'll continue with the self-care. I'm really excited about the new handout for you. Okay? Yeah, it comes from this book. So, just these few pages. Okay? I'm very excited about you trying this handout, okay? Let me know how it goes, okay? Work through it. Let me know if you have any problems with it. Any problems getting it to work. Okay? As always, I love seeing you. And I really hope that we can get you feeling better, okay? It is an honor to be with you. It is an honor to be a tiny piece of your life. And I hope that you will continue to share that honor with others.